The current state of healthcare is in flux. There's a big transition between what we've always known before, which is volume-based healthcare, to value-based healthcare. It's really about affordability. The volume-based world, there really is no budget. People practice as they see fit. You bill for a service and you move on. It's disconnected, and we've kind of proven nationally that we can't continue on that pace. It's bankrupting our country, for lack of a better word. Our approaching 20% of our gross domestic product. So we need to switch to something different. And something different is value-based healthcare. The value-driven world really is looked at more on outcomes and outcomes of populations rather than individuals. So that requires providers of care to really work a lot more closely together, PCPs to other PCPs, to specialists, to health systems, and all ancillary providers, to coordinate care across the continuum, to do that on a budget, to strive for better outcomes, higher satisfaction, and lower cost, or at least controlling that cost. That's a pretty complex problem. It's a pretty big paradigm shift from the way it's been practiced in the past. I think we need to work a little closer together. In the volume-based world, it's a very independent world. As I said, people kind of see their own patients, do their own thing. Don't worry too much about a budget. In a volume-based world, it's really going to be looked at a population or network level. So not about my patients or your patients, but our patients together. Not so much about episodes of care, but outcomes. With this shift in healthcare and physicians wanting to see their patients with all this swirling around them, I think we can do a lot of the heavy lifting on easing that transition. I don't know if easing is the right word. I think making it less difficult, perhaps, because I don't think it will be easy. But I think it can be less difficult by utilizing the resources offered through United Physicians, through educational support, through the sharing of best practices, from having practice transformation specialists in the office to help optimize the practice patterns regarding value-based healthcare. I think there's a plethora of resources that are available. The connection back to UP is very important. Physicians need to understand that we are here for the physicians and the physicians only, and united we can really hold our place at the table in negotiating deals with health systems, with payers, and frankly helping shape the way healthcare is delivered in Southeast Michigan.